here's our subject today. It's our annual OSHA record keeping webinar. This is, like I said, one of those subjects that every year we get over 100 people that want to log in and learn about this. And I know a bunch of you out there are actively doing this and all of that. You want to see the updates, what's new, and all of those things. And also, there's just a lot of minutia about OSHA record keeping. It's hard to remember everything and the little nuances that go along with this. And so we'll try to bring some of those out today, but also remember that Mike is a great resource for for you to talk to. So call Mike on now. You can call either one of us, and we will be happy to help out where we can. If you're looking for information, data on your claims, we'd be happy to help out with those. Be a little patient with us right now because we do get a flood of requests this time of year for that kind of stuff, and we'll get it to you as soon as we possibly can. But let's dive in. Some of you out there, you may be first timers. You just saw this announcement for this webinar and said, "What? OSHA? We have to do what? What do we have to do?" Well, this is for you as well as those who've been doing this for a long time. All right. We want to help you out to understand this. We want to help you keep your compliance obligations in place and learn about some of the new changes that are out there. We build this. There was a pretty major change that happened in this world this year, and we'll get to it in just a few minutes. So, but first, before we start, we want to make sure that everybody understands some subtle differences in here. We want to talk about the difference between OSHA and UOSH. And you say, what are you talking about? OSHA is the Occupational Safety and Health Administration. That's the federal agency that is responsible to enforce federal laws as it pertains to occupational safety. They regulate, they're over all of the country. However, they don't hands-on regulate all of the states. About 26 states have their own state plan where they're able to run all of those programs. So, and Utah is one of those state plan states. So in Utah, we have the Utah Occupational Safety and Health Division of the Labor Commission. And they have basically adopted the federal standards, and they administer all of those things. There are a few cases where they've added some additional clarity or additional regulations to that, but not too much. Other states like California have taken it to the nth degree, where they have added significantly to these health and safety regulations. But Utah has been pretty careful about this. UOSH decides to adopt which OSHA standards, but most of the time they don't have a lot of choice in it. And we'll talk about one of those right now in just a few minutes. That's that new update that we have and kind of where we stand on that. It's really a good time to remind everybody about labor law posters and your posting requirements for that, because you're going to be going out to post up your 300-day summary on that bulletin board, that common area where employees come and get their information. It's a really good time to look and make sure our posters are all current and up to date. You can go in and just print these up. There are lots of companies out there that like to sell you a product, and they look really nice. It's on a single poster, and they send you a new one out anytime there's a change, but it costs quite a bit of money when you can just go onto this website that I'm showing there, or you can just Google Utah Labor Commission and labor law posters, and it should come right up. And when you go there, you just click on each poster that you're required to have, print it, and stick it up on the bulletin board. So it's a good time to do that. Make sure you also have your posting there for your workers' compensation coverage. And you should have a sheet from the trust that shows you as being covered under workers' compensation with the trust. All right. Why do we have to do this? Well, number one, it's a law. It's a federal law. But I think injury records are really important. When we come out to visit you, or if we talk to you about something, many times we're talking to you about your losses. We'll do a loss run. We will talk to you about specific claims that you've had. And those are ways that we can learn. Those are ways that we can improve our safety program, is by looking back and saying, where did we have problems in the past, and where are we and where do we need to fix things? So along with OSHA, I agree that accurate records really help us to become better in preventing uh, future accidents and injuries that happen. Okay. Well, OSHA record keeping is a federal law, like I said. It's in 29 CFR 1904, and I always recommend that you go directly to the source for any of your regulations. You can listen to me and what I have to say, and you can talk to others, and that's great. I'm going to do my best to help you understand these regulations, but I always like to go to the horse's mouth and find exactly what it says in the regulation. It helps me to understand better. So if you type in 29 CFR 1904 and look for the result that has that is OSHA.gov, go right there, and it'll take you right to the regulation. We have forms that we use in here, and I'll be referring to the Form 300, Form 301, and 300A. I sent those out to you this morning if you'd signed up for this webinar before about when did I print that? Last night, sometime late last night. When I downloaded all of your email addresses to send that out. So you should find that in your email inbox right now, and you can refer to those. They are in a couple of different formats. There's a Microsoft Excel and a PDF version. We'll talk about which one's better for which thing. You have some posting requirements coming up. We do this every year right this time of year because this is when we get a lot of questions about this, and we want to help people meet this compliance obligation of posting your 300-day summary by February 1st. That needs to stay up till April 30th. So you've got a little bit of time here where you can complete those and make sure that they're all up to snuff, and then post them up for that time period. We're going to be talking about compensable versus OSHA recordable, and recordable versus reportable. And I'm sorry, this is a confusing subject, and we use a lot of words that make it kind of hard to keep track of exactly what we're talking about. Compensable refers to workers' compensation. That's totally separate from OSHA, even though they may be referring to the same injury or accident that happened. It's a separate program. It's a separate thing. The trust, if we are your workers' compensation carrier for your operations, and you have somebody that is injured in the course and scope of their work, it is probably a compensable workers' compensation claim. That means we will pay for that as part of your insurance. And that's different from OSHA recordable, right? OSHA recordable means that there is an injury or an illness that occurs in somebody working for you, course of scope of their work, of course. And it rises to a point where it needs to be recorded on the form. And we'll talk about exactly what makes something recordable. There's also recordable versus reportable. And I know that's confusing. There are certain injuries that are so serious that they rise to a point where they rise to a definition that you have to call up UOSH. That's what we do in Utah. If you were in a federal OSHA state, you would call federal OSHA and report those within a certain amount of time. And it's 8 hours here in the state of Utah. You've got to give them a call and say, this happened, and then we'll deal with that going forward. Okay. Some of you out there are saying, do I even have to do this? Is this something that I've never done this before? Do I have to do this? Well, maybe not. So there are possible exemptions from this record keeping requirement. If you have fewer than 10 full-time employees, if you have 10 employees at any time during the year, you're in. That's during calendar year. There are a few caveats that you got to keep in mind of that, because a lot of you out there may be fairly small organizations. We've got a few people that work in the office and a few people that work out in public works. But we total up about 6 people. Well, sometimes we forget about the other parts of the organization. You may have a volunteer fire department that has 20 volunteer firefighters that put in time as well. Well, they count as well. So be a little bit, well, look a little broader than maybe you think, who all are employees, and also, you know, I wouldn't be splitting hairs when it comes down to am I included or not, because I would rather report, or not report, I would rather keep this form when I don't need to than not do it and get a citation if OSHA happens to show up, UOSH happens to show up. Okay, there are some exempt workplaces out there as well. And so we'll talk about those in a minute as well. There are certain things like the trust. We are listed under our standard industrial classification, or the NAICS code, as insurance, and insurance is exempted. So we don't have to keep these records. Lucky us, right? We still have to report fatalities if they happen. Heaven forbid that we have a fatality happen. We are still under the obligation to do that. And if you're exempt, or you're fewer than 10 employees and you have a fatality or one of these serious things, I still have to report that to UOSH. If the Bureau of Labor Statistics sends you a questionnaire and says you need to track these things, even if you are not covered under OSHA, you still have to keep those. So when that comes in from Bureau of Labor Statistics, pay attention to it. That is a Department of Labor obligation that you have to do. Okay. All right, Mike, I'm seeing a few chats coming in, but I can't see what there are. Is there anything that we need to cover?
Nope, that's just me putting in like the link for
just
the
banter.
Labor Commission posters and things like that. So
hey, awesome. Oh, you put that link in. Thank you so much. All right. So who counts as an employee? Full and part-time employees, volunteers meeting the state definition. Contractors are not employees. So if we hire a contractor to come in and install some public works facility, we don't count those. They keep their own 300 log. Okay. Temporary employees may or may not, and it really comes down to who supervises that temporary employee. If day-to-day supervision is given by you, you probably should have those temporary employees on your 300 log if they have an injury. Okay. So day-to-day supervision, giving them direction, that would be the line that they would cross, where you'd have to have them on your list of employees, or if they have an injury, track them on your 300 log. Here's the list of partially exempt industries, and you can look on there. Don't look too hard, because there are a few exemptions in here that may count, but for the vast majority of you out there, you're in. If you have public works type operations, even though we've got a lot of office employees, if you have public works things or other more hazardous operations happening, you're in. Even if some of the other parts of this, I was thinking of like associations of governments, AOGs that we have around the state. Majority of them may fall into health, into medical or other areas. I was just looking here, offices of other health practitioners, or something that may be outside of that normally, but we have weatherization. We have things where folks are going out and doing more dangerous work there. You're in. And like I said, don't work too hard to get out of this, because it's not a major thing that we have to do. And we'll talk about some of the reasons why that burden is not as bad. Okay, OSHA recordable versus workers' comp claims. A workers' comp claim isn't always OSHA recordable. You're like, what? Really? And let's take, for example, I'm out working and I smash my finger with a hammer, and it hurts really bad. and I think I may have broken my finger. So I go to the doctor just for a diagnostic, right? I want to see, is this finger broken? Then the doc does an x-ray, looks at my finger and says, nope, it's not broken. Put some ice on it. You're fine. Go back to work. Okay. So that is not medical treatment. It's just diagnostic, and that doesn't count as an OSHA recordable claim. However, it would be a workers' compensation claim because here's an injury that happened at work and we've got to pay the doctor. And so there's a cost that goes along with it. And so that would be a work comp claim, but not an OSHA recordable claim. An OSHA recordable injury isn't always a workers' compensation claim. You're like, what? And the answer to that is, there may be some things that happen out there. Sometimes we have an employee that's pretty bullheaded on things, and they say, I am not going to the doctor. I'm gonna I'm gonna put some duct tape on this laceration, and I'm fine. I do not like needles or whatever their issue is, and we don't end up with a workers' compensation claim. Um, and so, eh, but would it still be an OSHA recordable? Yeah, here's a laceration that should have sutures, or maybe they put super glue. That would be the better example. They're just like, no, I'm fine. I'm putting some super glue on it, and we move on. So there's no medical cost. The trust isn't ever going to get involved with that. We won't have a workers' compensation claim for you in the system. A lot of you out there, or some of you out there, may want to get a list of your work comp claims from us, to help you make sure that you've got everything on your 300 log. And we're happy to do that. And like I said, just be a little patient with us right now, because we do get a lot of requests this time of year for those things. And so we'll get it to you as soon as we can. But don't think that that list that we send to you are all that could be out there. There could be those limited cases where we don't know about it. It doesn't become a workers' compensation claim. On the other side of that, just because it's a work comp claim doesn't mean it's OSHA recordable. Who makes the call on that? The employer makes the call. You have the responsibility to make the determination, is this OSHA recordable or not? And I can't do that. I can give you some guidance. I can help you think through the process. Is this or isn't it? And that's really why we do this webinar, is to help you walk through those. But at the end of the day, the employer makes the decision. Is it recordable or not? Okay. All right, Mike. I see a few more. I see a few more chats popping up. Anything we need to talk about?
Yeah, one of the questions was, if you have an employee that was injured in 2022 who is still off work in 23,
Yeah.
because they need to track days away from work for 23 and record the injury for 23.
Yeah, we don't put that on the next year. It was recorded in 2022, and you go back and you update your 2022 form. So we don't have to carry those forward. So it goes based on the accident date. And so great question about that, and one that we hear quite often. So that stays on your 2022 form, but you go back and update that. And so this is kind of a moving picture, right? A moving target with all of these forms. But I don't have to take an injury from last year and put it on this year's 300 log. Good question. Okay. There are a bunch of forms, like we said. OSHA Form 301 is the first report of injury. And it goes by a few different names. In Utah, we have Utah Form. I think it says 122 here. I think it's 121. I'm actually a little confused on that. There's a doctor's form and a first report of injury form. I'll have to look that one up, because it just tweaked in my mind. One's a 122 and one's a 121. It doesn't really matter. You can make your own forms. And as a matter of fact, here at the Trust, we send out our own first report of injury forms. It has the same information on it. You can make your own. You can put your logo on it. You can do all of that. You just got to collect the information that's required. And you say, what information is required? Well, you can look at the form that we send out, or it's just the information that the adjuster will ask when you submit a workers' compensation claim. This information, this form needs to be submitted to the Utah Labor Commission within 7 calendar days. Some of you out there just panicked a little bit. What? I've never done that. Well, that's okay because we do that for you. If it's a workers' compensation claim, we will submit that. You give the information to the adjuster. As that is entered, it automatically is submitted, transmitted over to the Utah Labor Commission. And so that is done for you. You don't have to worry about that. Now, just be advised though, if there is something that is an OSHA recordable that is not a workers' compensation claim in those limited cases, then that's on you, and you'll need to, because we don't know about it, and so you'll need to submit those. Okay. Like I said, the doctors submit a corresponding form, a 121 or 122, and those are OSHA, UOSH will compare those. If they come out to do an inspection on your facility, they'll say, here are the number of doctor's forms that have come in. Here's the number that you have submitted, and they don't match up. Now, they're not always going to match up because sometimes people will errantly put in information and tell their doctor that this is a work-related claim when it isn't. And so there, at times, those stacks of forms may be a little bit different, and there's a way to explain around those. But we also have to realize that there's some checks and balances there, and so those need to go in. All right. Here is the 300 form, or the 301 form. This is the first report of injury. Like I said, you can use whatever form you want. You just have to collect the information that's required on there. And that's in that packet of forms that I sent you this morning as well, so you can take a look at that, verify that you're collecting all the required information. Okay, recordable versus reportable. Recordable injuries go on the 300 log, the OSHA 300 log. Reportable injuries must be called in to UOSH, Utah Occupational Safety and Health. All reportable injuries are recordable. Okay, but not all recordable injuries are reportable. So what do we have to report? Reportable injuries have to be called into UOSH, and there's the phone number right there, within 8 hours of the occurrence of all what? Fatalities, disabling, significant, and serious injuries or illnesses. Well, that's kind of up for debate. Fatality, not up for debate. That's a fairly clear and easy to define thing, but the others get a little harder. So I've got to call this within 8 hours. Here's something that came from the UOSH website, and they defined it here. They say, what is disabling, serious, or significant injury? Any injury resulting in admittance to the hospital or impairment, permanent or temporary, where the function of any part of the body is substantially reduced or made useless, which would require treatment by a physician or other licensed healthcare professional. Examples include, but are not limited to, the following: amputation, fracture, deep laceration, severe burn, thermal, chemical, etc., electrical burn, sight impairment, loss of consciousness, and concussion. So a good chunk of things that are there. They really don't want to hear if you fractured your pinky. If you fractured your femur, they do want to hear about that. If you have a paper cut, they don't want to hear about that. If you cut your leg off, they want to hear about that. If you go blind, somebody goes blind, loses an eye, they want to hear about those types of things. So you may question that. Why don't we just call everything in? Well, there's some consequences on the other side of that. If I don't, or if I call that in, chances are UOSH will come and pay you a visit. They'll do an inspection, and it may be a wall-to-wall inspection. It may involve citations. It may involve other unpleasant things as well. So if you don't have to report it, don't. But if there's ever a question on this, give us a call. That's why we put our cell phone numbers out there. I've received calls on these on the weekend. Hey, this just happened. What do we do? do we need to call this one in? And we'll walk you through on that. I'm going to be a little conservative on that when you give me a call, to make sure that we don't get you a citation for not reporting. But there are some times when it's no, I don't think this is one that you need to call. But if there's any question on that, give Mike or myself a call, and we're happy to walk you through that. Okay. On the OSHA side, they actually upped their requirements to 8 hours as well on fatalities, but they're still staying at 24 hours. You got to call if for any inpatient hospitalization, amputation, losses of an eye. But we don't have to worry about the federal requirements because we are reporting to UOSH. Okay. All right. So, new requirements. Well, these are not the 2024. These are fairly recent ones. We'll talk about the big 2024 changes on the next slide. Several years ago, we had an executive order that said certain industries need, or certain employers in certain industries need to report their 301 data. Need to report their 300A data. I think I actually took the wrong line out of this slide. So your 300 log is your 300 log. You don't have to send that to anybody. That's one of the most common questions that we get. Who do I send this to? You don't send it to anybody. Now we'll put a caveat on that on the next slide. OSHA, federal OSHA, said several years ago, if you're in these industries, you need to send in your 300A data every year. And some people are like, what? I haven't done that. What do I have to do? Here's the big but at the bottom. We are governmental agencies within the trust. And state and local governments are not regulated by federal OSHA. Okay, so none of the requirements from federal OSHA are enforceable from federal OSHA for our governmental agencies. We are regulated as state and local governments, governmental agencies, by UOSH. That's one of the caveats they put on there for states to have their own plan, is they have to regulate state and local government agencies as well. Okay, and so you say, well, what about that? Well, UOSH says they don't want this data. They already have it. Remember, we talked about that, the forms 121 and 122. They have all of the data that they need to do this. They also don't have access to federal OSHA data as well. So if you are a governmental agency, you are under the NAICS code 92, public administration, and you're not required to submit this to federal OSHA. So all the concern about that, don't worry about that. Let me go on to the next page, and this is the 2024 big changes where they have required sending in the 300 data, not just the summary data, the specifics about claims. This is federal OSHA, and there are standards for that. There's a website here you can see if you have to submit, but let me cut to the chase. You're a governmental agency. You don't have to submit. And additionally, UOSH has not adopted this change, and so they don't care about this. So I've spoken with the UOSH representative about this and clarified that. So we don't have to do any of this. All we have to do is keep our 300 logs and maintain that information. And sorry about that, folks. Can you still see my page? All right.
Yeah, you're okay.
Okay. All you have to do is maintain your 300 logs for 5 years, right? So the current year and then 5 years previous, put it in a file. You can have it on your computer as well, but have that available when OSHA comes to visit you. You don't have to send it in to anybody. The only things that we're submitting are the 301 or the 121 forms that go into the Labor Commission, and that's all done for you. Okay. All right. Mike, I see a couple more come in. Is there anything we need to touch on?
Nope, we're okay.
Okay, great.
Oh, Jeff did mention that employer form that you were mentioning is Form 122.
It's 122. I was right on the slide. I don't know why I quit. So the 121 is the doctor form. Thank
Yes.
you. Appreciate that, Jeff. All right. Just a temporary loss of sanity or something like that. All right. Recordable injuries. We got to decide what's recordable or not. Some of you are out there going, well, what? You said a few things in here. Let's go through the steps. And so we walk you through. This is probably the hardest part of this whole program, is determining, is something recordable or not. So they give us this flow chart. Did the employee experience an injury and illness? Well, yeah, that's why we're here. Is the injury or an illness work related? Okay. And we'll talk about some specifics on that in just a minute. Is the injury or illness a new case? And that's what we just answered a few minutes ago. If it's from last year, it doesn't go on my new OSHA 300 log, right? It's based on the calendar date when that injury occurred. So if it's a new case, then does the injury or illness meet the general recording criteria or the application to specific causes? Okay. And if it does, record the injury or illness. If it doesn't, don't record it. All right. You're saying, well, that doesn't help me out a whole lot. Well, let's talk about that then. So we're talking about an injury or an illness. Injuries seems fairly clear. It's an abnormal condition or disorder, cuts, fractures, sprains, amputations. Those types of things are injuries. An illness is something different. Well, when we think of illness, well, I got a disease. Those can be, but they can also be occupational illnesses like silicosis. Let's say I'm out cutting concrete for my career, and I end up with a chronic lung disease, silicosis. That would be an illness that would be recordable. Okay. All right. So recordable illnesses would include things like skin disorders, respiratory conditions, poisoning, hearing loss, tuberculosis. There are some diseases out there that are recordable. Tuberculosis is one of those. COVID is one that is also recordable if it is transmitted within the workplace. But things like the common cold or the flu are not recordable. And I know I hate that it's kind of this isn't. COVID messed a lot of things up, and that's one of those that is kind of outside of there. And you say tuberculosis, well, you think about some of the types of work that we do within local government agencies. We have health departments out there who are working with people who may have tuberculosis, and they could have that transmitted within the workplace. That would be a work-related recordable illness. Okay. Recording criteria. Number one, it needs to be work-related. It needs to be a new case, not last year's. It could be a significant aggravation of an existing condition. We'll talk about that one in a minute. And it needs to meet the OSHA recording criteria. A case is presumed work-related if and only if an event or exposure in the work environment is a discernible cause of the injury or illness or of a significant aggravation to a pre-existing condition. All right, so it's got to be work-related. And there are a couple of things that are exceptions on the next slide we'll talk about, but let's talk about a significant aggravation. Let's say I've got a bum knee that I've had issues with in the past. Maybe I've had knee surgeries or something like that. That isn't that, and it's not work related. It's something that was just happening that I had before. But I came to work and I slipped on some ice and did some significant damage to that pre-existing condition. Well, that's a significant aggravation of a pre-existing condition, and that would be something that would be recordable on our OSHA 300 log. It's got to be work related. Here are a couple of exceptions to this. If I'm not working, let's say, I was doing regional training last week. I was down in Moab, and let's say I had some free time at night, which I really didn't. But I went out and went hiking in the slick rock and fell down and hurt myself at that point. Well, even though I'm on a work trip, I'm not working at that point. However, if I were, I'm doing my training down there and I trip and fall when I'm doing that training, that would be a work related thing and thus recordable. Okay. Personal errands are not that way. Recreation, fitness, those things are not recordable. That one can get a little bit blurry when it comes to things like our public safety, where they have required PT training, physical training, where they are required to do that as part of their job requirements. So let's see. Eating, drinking, preparing your own food. If I cut my finger when I'm preparing my food, or I burn myself, those are not recordable cases either. Grooming, personal meds, those types of things. If I overdose on my prescription drugs, or I poke myself in the eye when I'm trying to comb my hair, those would not be recordable things. Motor vehicle accidents in the parking lot or on your commute, those are not. Cold and flu, not. Mental illness are not recordable cases. All right. COVID. Oh, aren't we tired of COVID? COVID cases are recordable if it arises within 30 days of a workplace exposure. That's kind of hard to track. Back in the height of the pandemic, we were tracking these things really closely. I think COVID's kind of going to fade out here, but the requirements are still there in the OSHA regulations. So a COVID cases are reportable if it is a recordable case and the employee dies or the employee is hospitalized. And interestingly, though, adverse reactions to COVID vaccination are not recordable. Okay. All right. I see a couple more dots there, Mike. We good?
Yeah, we do have a question that I thought was important to bring up to everybody rather than try and answer it in the chat. But do we need to do the SOII returns for the Bureau of Labor Statistics?
Do we need to do what?
The SOII returns for the Bureau of Labor Statistics, the Survey of Occupational Injuries and Illnesses Data. Do we need to do that?
Yeah, and we did say that. So if you receive that, it doesn't matter how many employees you have, you're obligated to track those illnesses and injuries and return that information back to the Bureau of Labor Statistics. So yeah, good question. Absolutely important. Okay, recordable injuries. Deaths are recordable. Injuries with days away from work are recordable. Injuries with restricted work activity or illnesses, I say injuries, but it could be an illness as well. Injuries or illnesses that require a job transfer, that have a loss of consciousness that is work related. If I just didn't eat my breakfast and I stood up too fast and fainted, yeah, those are probably not a work related thing. However, if I stand up too fast and I pass out and hit my head and get a concussion or have to have sutures for a cut on my head, yeah, that definitely would be. But if I'm at work and I get hit on the head with something, somebody drops something, or I bump my head and I lose consciousness, that is a recordable case. Significant illness or injury, or medical treatment beyond first aid. Most of those others are pretty simple, right? Yeah, it's pretty clear that this would be a recordable case. They got injured bad enough that they lost time from work or they died. But when it comes down to medical treatment beyond first aid, that's where we start splitting hairs and it gets a little bit challenging. So we say, what is medical treatment? It's the management and care of a patient to combat disease or disorder. Okay. It's kind of complicated. What is first aid? OSHA doesn't give us a definition. They just give us examples. And so let's run through the examples that OSHA gives us. And I think that's probably the best way to help us get on the right track on determining, is it medical treatment or is it first aid? First one, non-prescription at non-prescription dose of a drug. So let's say one of our people has a sprain or strain. They go to the doctor, and the doctor says, "Well, it's not a big deal. Just take over the counter ibuprofen and put some ice on it." Well, that would be first aid. But if the doctor gives a prescription, even if the employee doesn't fill the prescription, if they give prescription strength ibuprofen, that is a recordable case. Or they give painkillers or some prescription there, that makes it a recordable case because it's medical treatment. Okay. Things like drilling fingernails. They don't really drill them. They use a hot wire that burns through and allows the blood, the hematoma that's under the nail to escape. Feels a lot better once you once you release that pressure. That is first aid. Cleaning, flushing, soaking wounds. So if I need to clean up a cut, or foreign body removal, I wash my eye, or I use a Q-tip to get a speck of dust out of my eye. That's first aid. However, if it's surgical removal, it's something the doctor needs to, we got a foreign body, that a sliver that has gone in, and they have to use surgical means to remove that, that would be a recordable case. Other things like staples and sutures are not first aid. If you have to get staples, that is something that is a recordable case. Bandages, steri-strips, butterfly bandages, that's all first aid. But the question is, what about super glue? And they call it medical glue, and that is a medical treatment. So keep that in mind. If they glue a laceration together, a wound together, that is medical treatment. You got to record that on your 300 log. What about a brace? It says in here non-rigid support devices. So it's kind of a hard line they draw there. What's the hard line? It's how hard is the brace. If they give you a rigid brace that holds your knee or your wrist straight, that is medical treatment. Temporary isolation is first aid. So if I hurt my finger and I think maybe I broke it, so we put a popsicle stick on there and we buddy tape it together with the next finger, and we go in to get checked. And they say, no, it's not broken. Just because we put a splint on it doesn't mean that it is a recordable case. But if the doc says, hey, your wrist needs to be isolated so it can't move, so we're putting you in a rigid brace, then that would be a recordable case. Vaccinations. I'm sorry, some of these are really nitpicky back and forth. A tetanus vaccination is first aid. However, a hepatitis vaccination is not, if it is coming after an exposure. Now, if I just go in and I get my hepatitis vaccination because I'm working with bloodborne pathogens, that we don't have to put that on there. But if I get a needle stick and I go to the doctor and the doc says, hey, you haven't had your hepatitis vaccination, and they give you that vaccination, then that is medical treatment, not first aid. But just a tetanus shot is first aid. All right. Hot and cold therapy is first aid. Physical therapy or chiropractic is not. That is medical treatment, and you'd have to record those cases. Massages are, to a certain extent, are first aid, but where does the massage end and physical therapy begin? That's something that you probably want to discuss with the medical provider. Okay. First aid. For needle sticks, well, all needle sticks are punctures by sharps. Where that sharp, so if I get cut by some glass that hasn't touched anybody else's blood or bodily fluids, that's not. But if I get stuck by a needle or some other sharp object that has somebody else's blood or potentially infectious material on it, that is a recordable case, and there's a special place that we put that on the OSHA 300 log. All right, now we know what has to be recorded. Let's talk about how we record the cases.
So Jason, real quick, I'm going to jump in and ask a question because I think it works well here. That is it best practice to just record any employee injury that is reported to a supervisor, manager, HR, regardless of it being quote recordable or quote reportable?
Here's what I would say on that. Let's record all reports, right? Anything that comes in, let's put it on a log, but probably not your 300 log. I want, because the reason around that is we don't want our 300 log to be full of stuff that doesn't belong there. Because if OSHA does come and take a look at it, and they look and you've got multiple pages of cases there, they're going to say, "Ooh, this place has got some problems. We really better look a little deeper into what's going on if they're having this number of cases on their 300 log." So yes, we should track everything. That allows us to do incident investigations and be able to prevent recurrence of these types of injuries that happen, but only put the stuff on the 300 log that should be there. Okay. So how do we complete it? I've just got some pages out of the 300 log. It's pretty simple. You guys have got the forms, and take a look at those. If you do have questions about those, let us know. But let's just remember that recordables need to be on your log within 7 days of knowledge that the injury occurred. Sometimes it's going to take a little while to find out that it happened, right? If it's a occupational illness, when did that occur? Well, it's when we become aware that it happened. Okay. Update the log as claims mature and change. When I was in the old days, when I was keeping 300 logs, I had a reminder on my calendar that would pop up once a week that said, "Update your 300 log." And I would do that on a fairly religious basis, every week, go in and look. And if I had somebody off work, then I'm going to update the days. If I had somebody on restricted duty, I'm going to update those days at that point. Some days it would pop up and say, "Update your 300 log," and it's like I got nobody off work, nobody on restriction, and no new accidents, and it was a good day. Maintain these logs for at least 5 years. So the current year and then the 5 preceding years, because OSHA is going to want to look at those. So both your 300A and your 300 logs, both of those need to be accessible for OSHA when they come out to visit. They can be electronic or a hard copy. All right, so here's the overall for OSHA 300 form, and we'll zoom in on those and just talk through those. So we have case number. You say, "Well, what's my case number?" You make it up. Now you can use the workers' compensation claim number. I would recommend probably not doing that. Some people like to do that. I would always just use the last 2 digits of the current year. So I would put 24-001 for my first case, and then just continue on 24-002 for the next one. But it's totally up to you. You make that up. What's the employee's name? Okay, put the employee's name there, their job title, date of injury or onset of illness. It's pretty easy with an injury, a little harder with an illness, but it's where you became aware or where a doctor made a diagnosis of this illness had happened. Okay, where did it occur? And be specific about these things. You see where they say let's see, loading dock north end. And then describe the injury or illness, parts of body affected, and object/substance that directly injured or made person ill. Okay, so what would that be? They give us an example: 2nd-degree burns on right forearm from acetylene torch. So what was the injury? Where did it occur? What body part? And what was the cause of that injury? Okay, so just follow that format, and you've got it. And then we follow this over across the page, and we've got to classify what the case is. Is it a death? Did it have days away from work? Did it have a job transfer? Or was it an other recordable case? It may start out as an other recordable case, and then as it progresses, oh, the person ended up going in for surgery, and they had some time off work. And so I can update that and make it a days away from work claim. Oops, I go back and forth. I said claim, case is what we're talking about. The number of days or the injured or ill worker was away from work or on job transfer or restriction. Okay. So days, how do we count? These are calendar days, not the days they're scheduled to work. So if they're injured on a Friday and the doctor says take 3 days off work, or take 2 days off work, and they weren't scheduled to be there on the weekend, and they come back on Monday, their regularly scheduled day, they still have 2 days or 2 days off of days away from work. And it's calendar days. So we don't have to worry about scheduled shifts or anything like that. How many days do I put on there? I go to 180 days and then I can quit. If it lasts that long, that's where I have to stop, where I can stop counting. Job transfer. This is only if the restrictions require them to be transferred or change the job. So let's say my job is, or my injury involves my left hand, but my job only requires me to do stuff with my right hand, and I didn't change, those restrictions didn't change what I had to do at work. I don't necessarily have to count those restrictions, okay, those restricted days. So let's see, we covered all of that. And I apologize, guys. I know this is a long webinar. It's just such a giant subject. We have volumes of material to go through, and I'm sure we'll have plenty of questions as we go along. And feel free to talk to us about that. So our days away from work, we start counting after day one. We don't count the day of injury, and they're calendar days. We stop at 180 days, or if the employee quits, or we don't have any information on that employee, then we can stop counting at that point. Job transfer restriction, move or day with restrictions. We don't do the first day once again. And those other recordables cases are everything else. No lost time or no restrictions on job duties, or if the job duties meet the restrictions, or if their normal job duties meet the restrictions, it can be an other recordable case. Okay. All right. 300-day summary. So once we've got all of this done and we complete the year, so we've just done that for 2023, you have your 300 log. We're going to summarize all of that information and then put it on Form 300A summary. It takes out any private information, names, and all of that. And we put this summary up on our bulletin board, a common location for employees. Generally, it's by the time clock or where you post all of your other labor law posters where employees are. A lot of times it's around a break room. Some sort of, and when I say public location, I don't mean to the general public, but public to our staff. We don't put any personal information on there. There's a certification. Your chief executive needs to sign off on this that say this information is true and correct and to the best of their knowledge. And we put it up on that. What form do you use? You'll notice in those forms that I sent out today that there were two different versions of the 300 log. One was in PDF and the other one was in Microsoft Excel. The PDF form, I recommend that you take the instructions out of that, so to help learn how to use it. But for practice, I would use the Excel version. Why is that? Well, number one, because I'm lazy. And at the end of the year, when it's time to do my 300A summary, it's already done for me. So if I put all of my all of my cases into my 300 log, it automatically populates the 300A. And then all I have to do is put the information about my facility, but all the numbers will be current if my 300 log is up to date. And so it makes it really easy. And then all you have to do is print it off from Excel, and you're good to go. So let's just take a quick look at what we have. The establishment information. And here's one of the tricky parts, and this is probably one of the hardest things of this whole subject, is the definition of establishment. We talked about is if you're included in this regulation, if you're required to keep a 300 log, that's based on your total number of employees. But when we take the log, once we're in, it needs to be based on your establishment. So what that means is you may have more than one location. And if employees are not sharing a common area where they come together, they have their own establishment, a different building, you may be keeping a 300 log and posting a 300A summary for each of those locations. So just for example, we're here in North Salt Lake. Across the road is North Salt Lake City Hall. Well, they have the police department and all the administrative offices are there. Well, that is one establishment. But if you go further west, North Salt Lake has a public works building. They also have a parks building, and they're separate. They are two different facilities, and they have their own break areas and places where people are punching a time clock and all of those things. In my mind, those would be each individual establishments. And so we'll have to keep that log for each one of those. And I know that gets messy for some of you out there that may have a dozen or more of those different establishments. But we put that in here in this right-hand side of this page on the form: establishment name, location, industry description. What do you do there? And the standard industrial classification and or the NAICS number. And for that one, you can put 920000, and that's government administration. And that's kind of our get out of jail free card on some of those other things if we put that in there. Employment information, the average annual number of employees, the total hours worked by all employees last year. That's some of the hardest stuff is coming up with that information. And then the signature by the chief executive. And that's the chief executive over your whole organization. Okay, so we look over here. What kind of information are we looking? I should have done that. Sorry. I had a better slide for that. What else are we looking at? Total number of deaths, total number of cases with days away from work. This is what you're going to be posting on your 300A summary. Total number of cases with job transfer or restriction, total number of other recordable cases, and then total number of days away from work and total number of days of job transfer or restrictions. And then a summary of injuries, skin disorders, respiratory conditions, poisonings, hearing loss, and all other illnesses. Okay. There's some other things out there. We saw hearing loss. If you have questions around that, we don't just say, hey, this person got their ears rung out at the firing range. That's a hearing loss. Well, there's certain requirements for that. Please give us a call on that before you record those, and we'll walk you through that. Medical removal. Some things, like if you're working with lead and you have to be taken out of the environment because the amount of lead in your bloodstream is too high. That's something that we have to record as well. Have questions about those things? I don't think there are many situations out there in trust membership where we would have to do that. But if you do have questions, give us a call. TB, tuberculosis. If somebody contracts tuberculosis in the course and scope of their work, that's something that has to be recorded, and there's a way to do that. Talk to us about that, and we'll help you on that. Certain cases are privacy cases. So we can have a separate list for privacy cases, separate log for things like injury to people's private parts. If they contract HIV, AIDS, hepatitis, a disease like that, if they're a victim of sexual assault, mental illness things, and needle sticks where contaminated with other person's blood or bodily materials, potentially infected materials. Those need to be in a separate list as a privacy case, and of course they should be controlled in a locked cabinet or in a directory where not anybody can access. Okay, generally human resources will be tracking all of this information. And if the person requests that their case not be on the regular 300 log, we put it in a privacy case as well. Okay, boy, we've covered a lot of stuff. Couple of must-dos here. Have a separate 300 log for each establishment. Ask yourself, what are those establishments? Record these cases within 7 days. It's easy to forget about it. So put that reminder on your calendar to update those each 7 days, and then we don't miss getting those on there. We're happy to give you a list of your claims, But it's a lot nicer if it's all up to date at the end of the year and you don't have to worry about it. Review, certify, and post your 300A by February 1st. Keep those forms for 5 years and provide employee access. If an employee comes to you and says, "Hey, I want to see how my case is recorded on the 300 log," they're legally able to do that. Now you can tell them, "Hey, I need 24 hours. That's the reasonable time frame. I wouldn't go beyond that. I need 24 hours to make sure that log is updated and to make sure I can redact or make sure that you can't see other people's information that you're not able to see." But they can take a look at their case and exactly how that is recorded in there. Doesn't happen very often, but it can. Few things: talk to your providers, let them know that you accommodate restrictions, get people back to work, because if we can prevent those lost days, that's good in a lot of different ways. One, it doesn't go on there as a days away claim or case on your 300 log, and it doesn't become a lost time claim in work comp. That costs you a lot more money in your overall premiums. It hits your EMOD a lot harder. So accommodate restrictions, let the doctors know that you do that. Prescriptions: if you see a doctor is regularly writing prescriptions for prescription strength ibuprofen, maybe have a discussion with the doctor and say, this makes it so we have to put this on our OSHA log. If is it okay if they just take regular strength ibuprofen for this, or is there really a reason for that? That's their medical decision to make. But sometimes doctors, and I've had discussions with docs where they're like, "Oh, I didn't know that. I was just making sure they were able to get it." And we were like, "Hey, we have ibuprofen at the workplace. They can use non-prescription strength ibuprofen there." "Oh, okay." And we made a change. Provide first aid. Be involved with cases. Know what's going on. I have a few pages in here just on the reporting stuff, but like we said, it doesn't apply to anybody, and I'm already over an hour. And so let me just skip a couple of things. Oh, just on on these new rules, like I said, UOSH has not adopted the new standards for reporting. We're out anyway because we're governmental agencies, but UOSH in many cases is kind of trying to hold the line. They put their foot down, and so, but every once in a while, OSHA says you have to do this. But I think right now we're in good shape at being governmental, and UOSH hasn't even adopted those things. So let me just get to final slide. That's really what I had to talk about today. There's a ton of stuff we've gone over. Apologize for being over an hour, but it's a lot of stuff. If you have questions, please type those into the chat box. Maybe Mike's got some already. If you don't want to ask it right now, give us a call, send us an email, and we'll help you out with that. What do we got, Mike?
Yep, got some queued up for you. First one: is there any indication that this information can be posted electronically in the future?
Will you say that again?
These OSHA logs, 300, 300A logs, is there any indication that they maybe potentially being able to be posted electronically rather than on paper?
Well, they absolutely can do it electronically as well. Like we said, there's a PDF form. You can do it that way, but you can also use that Excel form, and that's what I recommend is do it electronically.
What about posting in the workplace though?
There's nothing in there. It's a physical posting, is how I interpret it.
Yeah, me too.
As far as posting, and that's one thing I didn't get into a lot of detail on that because it doesn't apply, but OSHA is going to take some of that information when you're posting, when you submit your 300A, which we don't have to. But that information is not only just going to OSHA for them to direct and say, "Hey, this company has a lot of injuries for their size or for the industry. We're going to go in and target our inspection on them." That's part of it, but also they're going to make some of this information available to the general public. And so that can make companies look pretty bad. And there's some good in shame, but it's also a risk to your organization. Fortunately, we don't have to report that. So what else we got?
Record retention. OSHA and training records in relation to employees present and past. What records and how long must they be
Yeah.
retained?
So here's the deal on employee stuff. When it comes to the hazard communication program, so MSDSs and SDS sheets that we have, the record retention requirement on that is 30 years past the last day the employee worked there. So basically, it's forever on those things. Training records, I would probably follow something like that after the employee has terminated. I would come up with a retention on that, just because things could come back on you. Somebody comes back with a complaint about or OSHA comes in because a former employee complained about something, and you want to have those records available. My opinion is, on that kind of stuff, I keep that stuff pretty much forever.
Mhm.
I'll put it in electronic format and keep it, just because the downside of disposing of that, deleting it, is it just doesn't exist anymore, and we might run into a problem, a lawsuit or something like that down the road, and we want to be able to prove, hey, that employee was trained on this particular subject.
Yeah. Restriction. Restriction means light duty, right? When you say restriction, we're talking light duty and things like that. Yeah.
Correct.
Another one. We sold one of our establishments in the last year, and all the employees that were assigned to that establishment are now assigned to a new one. Do we
Mhm.
need to make a 300A log for the old sold establishment? And if so, where would they need to post that?
If it's sold, what I would do, just to cover my tail, is I would make the log, but the building doesn't exist anymore. I just stick it in the file.
Yep.
Right. I would save it. And while we're on this subject, I had a question about this the other day. Somebody said, "Hey, we have remote workers. What do we do about them? Do we post is that an establishment if they're working out of their home?" And I think the best thing to do on that is, where is that employee's first home base, right? Where do they come to work? Because maybe there are employees out there that are 100% remote, but I don't think that's necessarily the case with most. Most will, like this is the first day I've been in the office for probably 2 weeks, right, Mike? It's been
Yeah.
a I've been a road warrior for a while, doing training, but I'm here, right? This is where I report as an employee. So this would be the location. This would be my establishment, and so that's what I would look at: is where does the employee pertain to? Hey, they work for our finance department, but they work out of their home. But here's where our administrative building is, where our finance department is. That's where they would get this information.
Mhm. And then just a couple more here. For the signature that you mentioned on that form, as a county with a commission, does it need to be the commission chair or can it be the county manager?
So in a county situation, it's the chief executive, and so I would say the county manager or executive that
Executive is fine.
that you have there. In a pure county where they don't have an executive or a manager there, it would probably be the chair of the county commissioners. Whoever's the big boss, right? Whoever's making the executive decisions.
Yeah.
Okay. What else we got?
That's all we got.
All right. Not even any hard ones. Good. This is one of those subjects where we play stump the dummy, and normally I get stumped on on at least one that I have to follow up on. So hopefully we did okay. The only thing I got stumped on is the 121 and 122 today, but that's all right. Temporary loss of
Temporary loss of information. That's
That's
it.
right. Okay, folks, I know that was a lot of stuff. Thank you for sticking with us for that much time. Appreciate all that you do out there. Thanks, folks. Go out and have a safe day.